Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale of Two Hygienists in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everyone, Tom Viola from Pharmacology Declassified with yet another Fast Facts Pharmacology Edition, where we're continuing in our series of Fast Facts on dental pain management, and we're now going to be talking about NSAIDs from the aspect of, what do NSAIDs do exactly? Well, okay, we do know that NSAIDs like ibuprofen and naproxen, as well as others like Lodine and Relafin, are multifaceted. They have multiple actions. They are antipyretic, which means they're good for treating fever. They're analgesic, which means they're good for treating pain. And they're anti-inflammatory, obviously, non-steroidal anti-inflammatory agents. So they're great at treating inflammation. So that's good, right? Well, yes, but keep in mind that NSAIDs may be good anti-inflammatories, but they may benefit from being combined with a true analgesic like acetaminophen to achieve the maximum pain control necessary for managing pain like dental pain. Okay, so that's wonderful. We're going to use ibuprofen, naproxen, or another NSAID to manage acute inflammatory pain. Makes sense, but remember, NSAIDs have a dark side to them as well because of their effect on the COX-1 enzyme, and the fact that they can cause reactions in patients that are sensitive means that we've always got to keep our guard up as far as potential adverse effects and contraindications. For example, some patients can be sensitive to NSAIDs, meaning if they're allergic, let's say, to aspirin, there's a chance it could be cross-sensitive, meaning they could be also allergic to NSAIDs. But some patients are just sensitive, like asthmatics may tell you, because of the effect of ibuprofen, let's say, on the COX-1 enzyme and the prostaglandins that help cause bronchodilation. Well, by blocking that bronchodilation, that could be problematic for a patient with asthma, causing a bronchoconstriction, making it difficult for them to breathe. Sometimes NSAIDs have been known to cause significant dermatologic reactions like Stevens-Johnson syndrome, which is fatal 10% of the time, and toxic epidermal necrolysis, which can be fatal up to 30% of the time. Now, that's not necessarily something you can know in advance, but when it happens, you certainly don't, if a patient, let's say, gets Stevens-Johnson syndrome from a dose of ibuprofen, you never want to give them another dose ever again, right? Obviously, if they survived, that means don't use it anymore, okay? But what about patients who are pregnant? Well, we do know that NSAIDs can have some teratogenic effects, like prolonging the gestation time, interfering with fetal circulation, and even interfering with the production of amniotic fluid after week 20 of pregnancy. And we do know that NSAIDs can interact with and interfere with certain medications, most notably the once-daily aspirin a lot of people take to prevent thrombosis. The theory there is that the once-daily aspirin is to be taken first, then you wait 2 hours, and then you take your dose of ibuprofen, because when they're taken in the other order, ibuprofen then aspirin, or taken concomitantly, ibuprofen can interfere with the effect of that aspirin and therefore increase the risk of thrombosis and potentially increase the risk of both heart attack, stroke, and even pulmonary embolism. So we're well aware of ibuprofen's good and not so good treats, and so we've got to always keep those in mind when we're prescribing ibuprofen and with or without acetaminophen in the management of dental pain. In our next episode of Fast Facts Pharmacology, when we talk about pain management, we're going to talk about the most notable adverse effects of NSAIDs and their potential for causing harm. But until then, my friends, this is Tom Viola, wishing you to be well. Take care. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products, from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.